The health of the city can be an index of many things, from the struggle for housing to the effects of racial and economic inequality. That's one reason why cities routinely check for symptoms, whether it's in the toll of the opioid crisis or multiple racial disparities. The city recently issued its annual survey covering 2016 and 17. To bring us up to date is the executive director of the Boston Public Health Commission, Monica Valdes Lupi. Thank you very much for being with us.
Thank you.
First of all, there are some indicators here that show that things can get better if some effort is put into it. Talk about some of that in this report.
Sure. So I think the report gives us a sense of where the city, with Mayor Walsh and through the Boston Public Health Commission, which is the local health department for the city, has really made some strides. And this is something that we don't do alone. So there are many different partners that we work with. But in this biennial report, what we are seeing are improvements in some key health indicators. One, and I can go through several examples. Infant mortality is something that we've been working on for decades in the city of Boston, particularly disparities in infant mortality by race and ethnicity. And in this report, we see that it's decreased by 36% among our Black infants. When we look at another indicator in terms of teen birth rate, we've seen significant decreases nationally around teen birth rates. In the report, we show that there's been a dramatic decrease in Boston, over 57% decrease in the teen birth rate. Other good news from the report that we see is smoking. And we know that there have been a series of different policy steps that have been taken and programs that we've put out to the community. And what we know is that it's working, because what we've seen is a decrease among our high school students from 7.5% to 4.5%, almost a 50% decrease in teen smoking. So those are some of the things that we highlighted in the report in terms of health improvement.
A couple of numbers that look positive is, I guess, the decreased reliance on hospitals for dealing with asthma. Why do you think that's the case?
A couple different reasons. So we run an asthma home visiting program under our Community Initiatives Bureau. And we know that asthma is a chronic illness, and it's something that you shouldn't have to go to the hospital, particularly the emergency room, if it's well managed. And so we have staff at the commission who do home visits to make sure that patients, clients, kids with asthma are taking their medication to keep their asthma in check, and that avoids visits to the emergency room. So that's some of the improvements that we've seen in those asthma.
Now, I know you mentioned that teen pregnancy rates are down, and I think this is a statewide thing too, but is that because of some intervention, or is it something more accidental?
I think it's an intervention. I think what we're able to do and what we're fortunate to do in the city of Boston is really have open dialogue and discussions with our young people about taking a comprehensive approach to reproductive health, talking about safe and healthy relationships. If they are going to be sexually active, making sure that we give them the information that they need to take care of their health. And so a lot of the work happens through our school-based health programs and through our youth programs at the Commission.
Well, one of the least surprising things here is the increase in people affected by the opioid crisis. Is Boston any better or worse, you think, than other cities comparably?
I think what we see, are regional differences. And in Boston, what we have seen through our different surveillance systems and our data is when we look at the leading causes of premature mortality, why people die prematurely in the city, the top three include heart disease, cancer, and the third is accidental deaths. When you dig a little bit deeper into that third cause, accidental deaths, it's because of opioid overdoses. And so we do see we are able to rescue people who are overdosing using Narcan. So we have EMS and family members and bystanders who've been trained to use Narcan. But we also see an increase in overdoses, fatal overdoses, because of fentanyl in the different drugs that people are using. But we do see that there are regional differences.
Broadly, the opioid crisis has been characterized as a big race-neutral problem, maybe more white than others. But when you look at the mortality rates in Boston, it seems to be worse for blacks and Latinos.
And I think you're onto something in terms of what we see as the spokesperson or the face of addiction, especially with the focus on prescription drug abuse leading to heroin use. We know in the city of Boston that our communities of color, the heroin addiction has taken a terrible toll in these communities, and it doesn't discriminate in terms of race, ethnicity, income. So addiction cuts across all race, ethnic groups.
This has been in the news, and we're talking with the Executive Director of the Boston Public Health Commission, Monica Valdes Lupi. I want to ask you about some of the other things being tracked in this report that sounded first a lot less dramatic, and that is people experiencing persistent sadness or anxiety. Why is it important to track that?
These things are important. I know we have a conference that's coming to Boston next week that Northeastern is sponsoring called Diseases of Despair. Many health departments, including the Boston Public Health Commission, look at these questions around behavioral health to gauge overall health and well-being. And we know that behavioral health is one of those areas where there's a lack of resources. And so when we look at persistent sadness and experiences with trauma, depression, those things can contribute to addiction, to suicide, and other diseases of despair. So it's very important for us to not just look at the physical health, but the mental health and well-being of our populations in the city.
And if I'm not mistaken, I've heard there is a history of overlaps between things like obesity and mental health too.
Mm-hmm.
Right?
That's right. I mean, if you are experiencing trauma and stress, that's going to because you're juggling 3 jobs. You don't have a car to get to those 3 jobs. You also have childcare expenses. That's going to make it very difficult for you to take care of your family, and those chronic stressors become triggers for those physical reactions that we see.
Talking about triggers, your report looks at a number of externals, whether it's the level of safety in the neighborhood, the cost of housing, the level of education. Give me an example of how one of those externals can make a big difference internally.
Thank you for pointing that out. In this biennial report, what I'm really proud of the capacity and the expertise that we have in our staff, what we were able to do is look at these social determinants of health. What are these external contributing factors? The one thing that we were able to look at specifically is housing. And when we look at housing and the intersection with health, in the report, we're able to look at health indicators by housing status. So if you live in a Boston Housing Authority unit, if you have a Section 8 voucher, if you're rent, and if you are able to own. And when we look across a number of health indicators cut by housing status, we see a grim picture in terms of looking at, for example, our BHA and our Section 8 individuals who responded to the survey. They are more likely to experience those behavioral health issues, the persistent sadness that you talked about, issues around chronic diseases like hypertension and diabetes. And that makes it difficult for them to actually be well and to be healthy. We see that with safety as well, public safety, and how safe you feel in your neighborhood is going to impact your ability to go outside and get physical activity.
Or if people felt they were stopped by police on account of their race, they're going to have some feeling after that too, right?
Sure, and that takes a toll when you experience that kind of racism on a daily basis, and you're chronically exposed to those types of stressors.
Another health-related item about racism was in the Boston Globe Spotlight series a few months back, and they noted that there are some hospitals, especially where people of color feel that they get good attention and that people there are receptive to them, and there are some other world-class hospitals where they don't feel that way. Is it really about racism, or do you see some other factors feeding into that?
I think perceptions of racism play into it, but we're very fortunate in Boston to have, as you mentioned, these world-renowned hospitals. We have an extensive and rich network of community health centers. And I think some of the things that were highlighted in the Globe series is that these are complex arrangements and between the hospitals and their affiliation with different health centers and neighborhood-based care. And I think historically, people who are already experiencing barriers because of health-seeking behaviors, whether it's racism or just a simple bad experience in a primary care or hospital setting, that will impact the way that people tap into or navigate what is really a complex healthcare system in the city.
We should mention there's lots of ground that we didn't have time to cover, so if people want to see this report, what's the best way for them to find it?
Sure, and this is an original copy of the report, but you can go to the Commission's website at www.bphc, Boston Public Health Commission.org, and just look up Health of Boston, and you'll be tied to the link to download the report.
Thank you very much for being with us.
Thank you.
Monica Valdes Lupi from the Boston Public Health Commission.